1. Dromedary hump. What is it? A focal bulge on the lateral border of the left kidney, due to impression from the spleen. It's not a tumor, just a normal cortical thickening. Sonographic appearance. Isoechoic to the rest of the renal cortex. Smooth contoured bulge. No mass effect or distortion. No internal vascularity to differentiate from tumors. 2. Hypertrophied column of Burton. What is it? A normal extension of cortical tissue between renal pyramids, often mistaken for a mass. Most common in middle third of the kidney. Sonographic appearance. Isoechoic to cortex. Extends into the renal sinus but does not distort the renal contour. Continuous with the normal renal parenchyma. 3. Junctional parenchymal defect JPD. What is it? A triangular echogenic area at the upper or mid-pole of the kidney, caused by incomplete fusion of the fetal lobes. Sonographic appearance. Triangular echogenic bright area at the junction of renal cortex. Located near the upper pole, most common. No mass effect or shadowing. Foie extrarenal pelvis. What is it? A renal pelvis that extends outside the renal sinus, making it appear larger. Can mimic hydronephrosis, but it's not pathological. Sonographic appearance. Anechoic, cystic-looking area outside the renal hilum. No cortical thinning, unlike chronic hydronephrosis. Changes shape with patient position prone versus supine. 5. Persistent fetal lobulation. What is it? Indentations in the renal contour due to incomplete fusion of lobules. Common in children, but may persist into adulthood. Sonographic appearance. Scalloped, lobulated contour of kidney. Cortex remains smooth and uniform in echogenicity. No mass effect, unlike scarring. 6th, duplex collecting system. What is it? 2 separate renal collecting systems, sometimes with 2 ureters. Can be partial or complete duplication. Sonographic appearance. 2 separate renal sinuses within 1 kidney. Upper and lower poles may have different echogenicity. If complete duplication, hydronephrosis in upper pole, due to ureterocele. 7. Horseshoe kidney. What is it? Kidneys are fused at the lower poles, forming a U-shape across the midline. Can be mistaken for a mass or lymphadenopathy. Sonographic appearance. Fusion at midline lower poles. Isthmus seen as a band of tissue crossing anterior to the aorta. Normal renal function, but may have higher risk of obstruction or stones. Octa sinus lipomatosis. What is it? Increased fat deposition in the renal sinus. Common in older adults or those with chronic renal disease. Sonographic appearance. Echogenic bright renal sinus due to fat. Normal cortex and pyramids. No obstruction or mass effect. How to differentiate normal variants from pathology. Used Doppler tumors have vascularity. Normal variants do not. Check echogenicity. Normal variants are isoechoic to cortex, while tumors or cysts may differ. Assess contour and symmetry variants do not distort renal shape, whereas masses might. Compare sides variants are often bilateral or symmetric, while pathology may be asymmetric. Final tip. If in doubt, compare with the contralateral kidney. Normal variants are usually seen in both kidneys, while pathologies often affect one side.